Patient financing is topic number one, and this is the craziest thing that I've ever seen since 1995 when Care Credit knocked on my door. There is a new company in town, and they're called HFD, and they not fooling around. They will give financing to any person, and they'll give them 7,000, not 1,500, not 1,800. They're called HFD. And at first, when I saw it, I was like, this is crazy. This is impossible. This isn't sustainable. I've been watching them for 2 years before I'm ready to jump on board, but I'm ready to jump on board with them now. It's called HFD. They specifically partner now with Invisalign, and they are specifically partnered with AACA. I don't know how it works. I'm going to be honest. I don't know how it works. But here's what they offer, and I have tested it, I have tried it, and I know people who have done it. Who gets approved? Everyone. Everyone approved. And not just approved for a couple of bucks. 1,500 is not going to help you with Invisalign. It's just going to piss you off. 7,000. Everybody gets approved for at least 7,000. You only need 4,500 maybe for Invisalign, 5,000, whatever you need. A lot of people will, if they have ABC credit rating, they will get 15,000. I mean, we're talking about an entire practice that now has $15,000 to spend in your practice. And they can break that up over 12 months, but as much as 72 months. If the patient takes a 12 to 24 month payment plan, there's no interest to the patient. You shave off 10%, which is standard practice management. Anybody will tell you, if you take a 10% hit to get the money up front. That is straight up dental practice management 101. Everybody knows that. But if your patient wants to go extended plans, 36, 72, your percentage can go down to like 2%. It could be less than a credit card. It could be less than a Visa. Dave, this sounds too good to be true. Answer, I know, but I know a lot of dentists. I have seen a lot of Invisalign dentists, and they do it. How much does it cost to sign up? $0. What if I don't use it? $0. Everybody in your practice deserves straight teeth. There is no more you can't afford. There's only two types of people that are not approved. One, if you are in active bankruptcy, as in there are court documents for your local town, city, saying the city is coming after you for bankruptcy, you get rejected. Number two, and this isn't even a joke, it's true. If you're on the no-fly list, as in terrorist cannot fly, they don't give you money. Osama bin Laden would not get approved for Invisalign, 7,000. Everybody else gets approved. Listen, folks, I don't know how this is possible, but I met a dentist in October. He's the number one Invisalign provider at Heartland Dental, and he said he did $4 million in 18 months. Heartland Dental is using this. Aspen Dental is using it. Every provider. The only reason you don't know about it is because the people who are doing it, the dentists that are using it in your city, ain't telling you. They're not telling. Nobody's talking about it. That's how good it is. But it's time for everybody to get it. Because it's time for every person in America to at least have the ability to get straight teeth. Now, here's the problem. There's a cycle of inequality because these people can't afford the dentistry at your current prices and your current payment plan. They can't afford the dentistry, so they're stuck with these teeth, but they can't get the job that would be higher paying that would allow them to form the dentistry. So they're stuck at their lower teeth, which reduces their ability to get a great high-end job. Do you know many CEOs that have jacked up teeth? Do you know many high-end business doctors who have real teeth all over the place? You do not. There's a cycle of inequality. Why didn't these people get it when they were younger? I don't know. Who cares? Here's where they are now. HFD is a company that's coming in and saying, I'm going to break the cycle. Nobody else has ever done this. People have tried, but they're going to go, no, I'm going to legit break the cycle. They don't have down payments. They don't have to. I'm going to break the cycle. Everybody gets Invisalign. The number one GP in North America is a doctor named Dr. Michael Wallach in Philadelphia. He did 650 cases in 2025. He is the undisputed single office number one champ. When you talk to him, he says, hey, my patients are riding the bus. My patients are riding the bus. They're not driving Mercedes. My patients are riding the bus. The reason I'm successful is because I remove the financial barriers. And yes, he does use HFD. And all the top practices do. And now I just want to bring it to you. The regular men and women dentists in North America, it's time to open up your hearts to HFD. There's an inequality in this world because people with bad teeth can't get good Invisalign, but now they can. And it's simple. It's simple. You sign up for HFD. It takes minutes to sign up. They have a little iPad. They send a text to the patient. The patient fills in their information. Step number one. Step number two, it verifies their information. Step number three, soft credit check, not even a hard credit check, and it gives the patient 3 payment plans. Here's the game though. You get the good teeth. You're done in one round, which is an AACA concept. Get done in one round of Invisalign. 6 months later, you get the better job. Now you can just pay the whole thing off. There's no penalty for prepaying it. You, as dentists of North America, have a responsibility to try and break this cycle. I get it. We'll have more cases. You'll get a higher tier. You'll make more money. Blah blah blah. But there's something more exciting going on here. I hope you take this seriously. I don't understand any office that doesn't have HFD in your office. We have this one. We have that one. Okay, that's cute, nice. But this is everyone, and a minimum of $7,000. I know dentists who have increased their Invisalign fee because they know the patient's going to get 7,000. I'm not saying do that, but it's up there. Everyone should have HFD. Click this and enroll today.